Welcome.
Thank you.
Everybody. Thank you for coming along to the Dementia Knowledge Network for March. The year is already racing ahead. Our meeting today is being held on the lands of the Wurundjeri people, and I wish to acknowledge them as traditional owners. I would also like to pay my respects to elders, past, present, and emerging. Now, today we have Amy Yuen from Villa Maria Catholic Homes, or VMCH, speaking to us. Amy is a case manager for the Housing and Care Connections program, which is a care finder program. Amy's been working in homelessness for about 20 years and has previously worked as a case manager for the Assistance with Care and Housing program. So I will throw to Amy to run us through a bit of a presentation today. Thank you for joining us, Amy.
Thank you, Elizabeth, and thank you, Sarah, for your invitation. Good afternoon, everyone. How are you today?
Good.
Okay, so let me introduce myself. My name is Amy Yuen. I used to be a case manager, for the program called the Assistance with Care and Housing program. But since, January, last year, and no more assistance with care and housing, for the age program, and then they convert, to a care finder program. So we now changed, to a housing and care connections program now. So I'm still, doing, this similar role, but it's a lot of, differences, from before. So let me share, my PowerPoint first. Okay, so I have to start from slideshow. From beginning. So can you see my PowerPoint? Yes. Yeah. Okay. So today I would like to present the program under the Villa Maria at Home Age program called the Housing and Care Connections program. So the agenda today, a little bit overview, about the program, the objectives, target, and eligibility, and our housing and care connection, program services, and some case study. So Housing and Care Connections program is a free program to help vulnerable older Australians who need extra support to access housing, aged care, and community services. So the objective, of this program is designed to support people who do not have family or friends to help them research, apply for, and set up support services. Our particular focus is helping older people on low incomes or who are at risk of homelessness to find secure and affordable housing. So the targets and eligibility to access the Housing and Care Connections program for Villa Maria Catholic Homes. So actually, it's not only, just VMCH, the other organizations, Care Connect or Silver Care or Wintringham, they also, have similar program in other local area. But for VMCH, this Care Finder program, we are only funded, for the clients living in Knox and Whitehorse, and have no other person who can help you or not have a person who can trust or feel comfortable to support the clients and be eligible, for the government-funded aged care, such as, My Aged Care. And on top of, the criteria, and the client need to demonstrate, one of the following reasons why they require Care Finder program support. Firstly, whether they are communication issue like literacy or language problems, and also difficulty, to comprehend, information or make up decisions. I think, today is talking about, dementia. So it is very important, to know, whether the clients, can make up decision or not. And hesitant, to connect or engage with government or age services, or sometimes, the clients, have a very, very bad experience in the past, and then they feel, they have no confidence, to approach, the government or any community services on their own. So they need, someone to support them, to access or engage, with the government services. and also at risk of becoming unsafe or if they do not receive any services. So the housing and care connection services. So our team, in the meantime, just only me, but, I have Daniel, our manager, to support me. So it's available to help older people navigate the aged care system and access services to improve independence and quality of life. We can help set up services for the first time or support people to modify or change services. Just some of the ways we can help. So we can help include, firstly, speak to my aged care on a person's behalf or, try to send a referral to arrange an assessment. Or sometimes, we need to attend the assessment and provide support. And do some research or shortlisted, aged care providers and services in their local areas, and support the clients to complete forms and help them understand, about the aged care agreements or any documentation, related, to the services. Support, with the housing applications, and follow up and check in, with the client to ensure everything is okay or everything is on the right track. And help them, to link with other community services such as mental health, drug and alcoholic, or housing and homelessness services, or carer support services. And also, I need to conduct high-level check-in and assertive outreaching, for some cases, who has been discharged, from the program, but make sure that, they have been, receiving support, from the local area. So I would like to share, some case study. So this is a case quite a number of years ago, Mrs. C, so she suffers from early onset of dementia at the age of 50. So she is legally blind. So I remember, by that time, when I visited her, she was very vulnerable. She lived in a very big house, but, she couldn't afford, to pay for the rental. So when I visited her, she was always in tears. And, because, she suffered from early onset of dementia, and sometimes, she had difficulty, to know, how to, apply for the affordable housing or doing, advocacy, for herself. So I tried to support her and to apply for the public housing first and nominate her, for the supported, housing. So she had a guard dogs. So I have to look for a suitable places, for her so that, the dogs, can live with her. So because she is at high risk of, becoming homelessness, so we have a nomination right, for a transitional property in Rowville. So this is a 2 bedrooms, housing and quite spacious and have a very big backyard. So I found, this place is very, very suitable, for her. So that's why, I nominate her, to move in, with her guard dog. And that have a partner, sorry, go back. So, and he can look after her as well. And shortly afterwards, I worked with, the other aged care services provider. By that time, we didn't have the NDIS program. So even though she was, in early, 50, and I advocate, for her to apply for home care packages. So she received a high-level care home care packages. So that, the service provider can arrange, more services, to support her. And she was very, very happy. And she had lived in this, transition housing for more than 2 years. And end up, we found a very, very good place, for her, and 2 bedrooms. And there is a big garden, it's a permanent housing, under the social housing, under the Community Housing Limited. So she can live with her 2 guard dogs. And also, she married, her partner. So it was a wonderful outcome, for this lady. And I remember, I met her, in the street, one day, and she called me and say, she was very happy, with the living, environment now. So the other case is about a gentleman. So this gentleman sleeping inside a car. So he was referred to me by my aged care last year. And he used to be a very, very wealthy person. He was a businessman and running a very, very big business, in Indonesia. But, because of the COVID, and he lost everything. And then he come back, to Australia, found a job. But, because, he suffered from a work injury, so he couldn't, work, and then have to rely on, the age pension. And he couldn't afford to find a place in private rental. So end up, he was sleeping inside a car, and the car, parked in a factory, where the factory, was owned, by his friend. So he also, suffered from some mental health issue and also the back injury issue. And shortly after, I placed him, to a transitional housing. So he thanked me, very, very much. And he said that, his quality of life, has come back. So at the end, of my presentation, I will I'll show you the mass media. That was him, who shared, his, story with our marketing. And that, mass media, was posted in the social justice article. And the other case, about an Aboriginal couples. So under the Care Finder program, so we look after the disadvantaged group. And particularly, some like, from a cultural diversity background, or, some group, they are deprived, from the system, because of lacking knowledge or a bad experience, before. So this is, the Aboriginal case. They were referred to me by the Council Regional Assessment, Services. And the wife is the carer, for the husband, who has multiple health and mental health issue. And they live in a private rental. However, they cannot, afford the private rental, in the long run. So that's why they were referred to me. Now, when I support, this client, I found, I was facing a lot of barriers to support, this couple, to access, some services. Firstly, because they are lacking knowledge, about, the services, or, how to apply, or where to go. And secondly, because they are lacking confidence. I don't know why, they are lacking confidence. And then they need me, to do a lot of, strong advocates. So the husband, have multiple, health issue. And also, the carer, the wife is the carer. And she need to do the hip replacement. And then we need to find a respite care, for this gentleman. However, I have difficulty, to look for a respite care, for this, husband. I think firstly, because they lack confidence, to live in a more residential care area. Okay. And the second one, they feel confidence, whether they will be discriminated, in the mainstream, services. All right. So they talk to me and also discuss, with me, and also, share, their feeling, with me. And end up, I found a facility, who is very, very good and very close, to their home. And then at the very beginning, the husband still hesitated, to go to respite care. However, he had to understand, because if he didn't go to respite care, no one can look after him. And also, the wife, will be in the hospital, for the surgery, and the wife will need time to have a break, and also, for the health recovery. So with that, I explain very, very detailedly, and I provide emotional support, for this couple. and explain, more clearly, about the need to go to respite care. So end up, the husband, admitted, and then he was in respite care. The first week, he had a little bit, adjustment issue living in the residential care, but end up, like he started, to make friends, with the staff and also, the other residents, in the residential care. So end up, he finished the 6 weeks residential care. So I advocate, for him to apply for the carer support funding, from the Uniting, Carer Gateway, and then they fund, 6 weeks care residential care, 6 week, respite care, for this gentleman. And so they have more confidence, to use the residential respite care services now. Just recently, last month, and the wife, have some health issue. So the Aboriginal Health and Eastern Health, their staff, contact me, and then they said that, like the wife need a break, and the gentleman, need to go to residential respite care so that he can allow, his wife, to have a short break, for the health recovery. However, because, his the respite care funding, has already expired, and also he already utilized, the respite care funding. So I also, approached, VMCH, carer support services, but this facility is not under their registration list. So that's why, they can't, fund, the respite care, for this case. And I negotiated and discussed, with the facility, about the need of this, couple, and also they have financial difficulty, to pay for the daily living rate. So end up, this facility allow them, allow the husband to stay in the respite care and no need to pay for any, daily living costs. So it was very good. And then the husband, went to respite care, and the wife, have a short break, for the health recovery. Now, the other case is about a gentleman who suffered from cognitive functioning issue. So actually, this case, he was homeless, during COVID. So he was sleeping, he was physically homeless. He also and shortly after, he was placed to William Murray Catholic Home Affordable Housing. So my program, I want to talk about, my program about the partnership. So I'm using this case. So this program, we have the nomination rights for the independent living unit in Villara, located at 357 Stud Road, Montana South. And also I work very closely with VMCH, affordable housing. And also the Lionswood, Village, and also the Knox City Council. So Knox City Council, they have the housing support program. They have nomination right for more than 280, properties in the local area. So that's, what I work, partnership, with the other housing program, so that, I can make the best use to find the housing resources, for the client. So this client, and he has the Catholic background. So his friend, approached, our more high-level management. And so he was placed, to VMCH, affordable housing. However, when he have moved into, the property, the affordable housing, so we discovered that, he had difficulty, to look after, himself. And also, his cognitive functioning is, declining. And I suspect, a little bit, symptom, having dementia issue. So this case, I have a lot of barriers and to approach my aged care to have the aged care assessment to apply for home care packages, for him. So, so I feel very, very frustrated, when dealing with this case, even though, like I call my aged care many times and call the aged care assessment, many times. By that time, during COVID, it was picked. And the aged care assessment, for the home care packages, still hasn't been done. All right. However, he has, some issue to look after, himself. And also, he is very, very poor in financial management. And and he doesn't have any family support. He only, have 2 friends who are very, very close, to him and support him. So when making decision, it is very, very difficult. All right, because this gentleman doesn't have any guardianship order, and also we are very worried if he can make up a very, very good decision or not. So I work very closely with his friend, and so he doesn't have a home care packages to be approved, but he approved CHSP, Commonwealth Home Support Program. So I refer him to our CHSP for the domestic assistant first. Okay. And then I tried to refer him to the Alive Health, but he didn't turn up. He a lot of appointment. He missed the appointment. I think it was mainly related to his cognitive functioning, and also he is very, very poor in financial management. And I order meals delivery from the council, and he didn't pay the bill. So the council call me and say like he owned the council fee a lot. And so I end up like I have to investigate what happened to his financial management. He should have money because he received age pension. It should be enough to pay for the meals delivery cost. And he had falls at home, and then more frequently for the last couple of months, and he was sent to the hospital. And only when he was sent to the hospital, he was transferred to the rehabilitation center. The social worker reported to me and told me that he gave a lot of money to the carer who looked after him at home. So I was surprised, what happened. All right. So why, he gave, a lot of money, to this carer, and he didn't have money, to look after him. So this is, our concern. So I work very closely, with the social worker in the rehabilitation center. And so end up, he had a fall, and also, his cognitive functioning is declining. And then, so I discussed, with the hospital social worker, he has difficulty to manage self-care at home. So end up, he was placed to permanent care. So this is, how we have to, advocate, for a client, even though, like he lived independently at home. But when we discover that, he can't manage, self-care, so we have to support him, particularly, for those kind who do not have any family support, or any, people, or any friends who can, support him properly, and to do a more strong advocate, for this type of client. And so this is the case. That is, the case I mentioned, the gentleman, sleeping inside the car. So he was interviewed, by our marketing, department last month. And then his story was posted in the World Day of Social Justice. And this is a very, very successful case, how housing and care connection programs can advocate, the vulnerable clients, and then to support them to restore their quality of life. So this is our services. And thank you, everyone, to attend, my presentation. So any question, you are free, please feel free, to ask me or whatever.
Thanks,
so I
Amy.
stop sharing. Yeah.
Thank you. That was great. Those case studies were really interesting. They touched on
Yeah,
lots of different services and the need for, I guess, that um, connection with other supports and you advocating
yeah,
in, referring on.
yeah,
It's
yeah,
those people who really fall between the cracks for a lot of services that your service seems to be picking up. So
exactly. Yeah, and also, sometimes, client, in the situation, it's very tricky, like very tricky, and they need, someone to do the advocacy, for them, because client, they don't know, how to advocate or they don't know, how to express their need. So they need, someone to advocate on their behalf and coordinate, with the other services.
Mm.
yeah, yeah.
And I think
Amy,
that,
sorry.
sorry, I was going to say that's become more important because I mean, a lot of people now, they say, well, go on the website, put in applications online. And a lot of our clientele don't have the capacity to do that. So they actually need someone to go along with them to do all the applications, the interviews, because they get very overwhelmed. I mean, I don't like doing things. In some ways, I think, we've lost that human touch, doing everything electronically online. I was I was very miffed to go into my Aldi store the other day and I realized that they've taken all the servers and everything now is like they've only left one where you go through, you have to, the self-serve thing. So I think that that's a mentality that we really I think does the elderly people a bit of a disservice, and also from non-English speaking background and people with cognitive impairment and all of that.
Yeah. So even though, from the English speaking background, I got a case. And this gentleman used to be a very rich man, a very rich man, all right? However, he lost the money. So sometimes, people living in the other world, they don't know about the welfare system, all right?
No.
So when when he lost all the money, he had no money in the pocket, he lost all the money, all right? And then he had difficulty to access Centrelink payment. So I have to, advocate, for him very, very strongly and approach, I think an advocacy, body, particularly, for the Centrelink clients. So I make, very, very strong, advocacy, for him. And so that, he can have the age pension. So end up, he was very happy, when his, age pension, was approved, because he lacked the knowledge. He used to be a businessman, had a lot of money, and then have no idea, what's the welfare about, how to access and what is his rights. So this is very important, if we can have, someone, who know about the system and support the client to access the system.
Yeah, I think sorry, Ivana's got her hand up. I'll jump back to you, Jen.
That's okay.
Okay. Yes, my question is, Amy, I saw in your first case scenario that was a lady in her 50s. Do you have any other criteria that you can take referrals for people under 65?
So unless they have premature age-related disease, or they are Aboriginal and Torres Strait Islands, people, otherwise, this is not our area, because we are mainly taking clients who are over 65, under the aged care system. Yeah.
But in her case was because she had dementia.
The case, can be referred to the homelessness services.
No, I mean, in the situation that you consider her situation in her 50s, that was the reason because she had dementia, or that was something else?
So is it, under the dementia services, do you have any housing support services, under the dementia services umbrella?
No.
Do you have any, housing program, specific program?
I don't think so.
No.
Yeah, have to, go through the homelessness services. It is difficult.
Thanks.
Yeah, but, I put it down, because I will report back, because the Care Finder program is new, still new program. And they will want us, to pass the feedback to them. So that's sort of people, who have dementia issue. and need, you know, housing support. Okay.
And there are people who are aware of that issue and are looking into it. At the moment, there's only one facility in Melbourne that will take people with young onset dementia into permanent care, and it's over at Thornbury.
Oh,
Yeah.
What's it called?
Yeah, I
Run
can't
by Urella, I think. Is that
It
the
is
one?
Run by
it's
Urella.
one of
Okay.
the old Urella houses that used to be for respiratory support, and they've changed it to young onset dementia. It's a pilot, I think, or a new program.
Because
How many-
otherwise they get NDIS is pretty much what's covered under
Right.
from a young onset's covered through NDIS, but then
Yeah.
they can have difficulty accessing that, which we
Yes.
all know about that, especially at the moment. They're changing stuff and seem to be losing everything. So yeah, it's difficult. Yeah.
Rachel, did you have a question?
I did. I have a couple of questions, if that's okay, Amy. I just wanted to ask about consent. Like for that gentleman, Mr. O, that you were working with that had cognitive issues, had no guardianship, all that sort of stuff. How were you then able to get his consent to then place him into care
this
and
is very,
things like
very
that?
difficult.
Yeah.
So I passed back, you know, to the hospital social worker, you know, to follow up. So end up, you know, we found, you know, he has a sister, no, cousin. All right. And then we have to, you know, pass back, you know, to work to follow up, you know, whether he need proper public advocates or any guardianship order.
Okay. So did he get a guardianship order, or was it just consent through the cousin then?
Not at this stage, you know, I just
Okay.
know that, you know, he was placed, you know, to the facility, but we are not sure, you know, whether, you know, he had the guardianship order, you know, because it was done, you know, by the hospital social
Yeah,
work.
sure. And sorry, can I just ask, I just wanted to know how long are you involved with these clients? And I've had issues before with couple that had difficulty with the whole my aged care process. She had her own health issues, but was caring for her husband who had cognitive impairment. So are you able to help people when they're in a situation where even though they have a partner, that partner can't necessarily help?
Yeah. This is, you know, my area. But the point is, you know, like the case, you know, should live. If I take the case, you know, have to live in Knox or Whitehorse. Otherwise, you know, have to find, you know, other care finders.
Yep. But if they have if it's a couple, rather than like if there's a couple that you know.
Oh, that's fine. If they
Okay.
have, you know, some communication barriers, all
Yeah,
right, or
yeah.
the carers, like the Aboriginal case, you know, the carers, you know, can't advocate or can't do the job. So this is my role, you know, to support the couple, you know, to access the services.
Okay, great. Thank you.
Yeah.
Jan, can we circle back to
Yeah,
you?
a couple of things, Amy. I'm wondering in terms of the demand, because I would assume there's a really high demand. So I guess I'm asking, how do you prioritize, and also what happens to the people if there is a waiting list? What happens to those people?
The waiting list for public housing or the waiting list for
No, the waiting
program?
list for your Care Finder program.
It's very, very tricky because, you know, I was advised, you know, by my manager. So used to be, you know, I take up case, you know, more freely, you know, but, you know, because the funding, you know, is quite small and limited. All right. So I can only take 25 cases under, you know, my caseload. And also, you know, it is very different, you know, from EDGE program before. You know, I think Sharon, you know, had done the EDGE program. So EDGE program, you know, we can take up, you know, 60 cases. But now, you know, under the Care Finder, you know, because the case, you know, become more complex. So my manager, you know, suggests, you know, only 25. So I would prioritize, you know, to see, you know, whether this case, you know, how urgent, you know, the case is. And so sometimes, you know, I have to refer, you know, the case program. So if they need, you know, urgent support.
Yeah, okay. Can I ask another question, please?
Yeah.
Okay.
Sure.
I'm just wondering in terms of, given that it's a new program, and I know the funding comes from government, I'm not sure whether your agency, for example, your agency is responsible for the sort of auditing and managing all of that, or whether it goes to the central body, because my understanding is there's a central body that the funding comes to, and then it comes through to your agency. Is that correct?
This, my program is funded, under the PHM Primary Health Network.
Yeah, that's what I
care
meant.
finder.
Yeah, but it comes through the, yeah, okay. No, that's fine.
Yeah.
Okay.
So the PHN work very closely with our VMCH accounts department, and also my manager about the reporting system, how to manage the funding.
Okay. And I'll just quickly say, and then I'll stop. In terms of council, we've actually set up and just starting now in terms of a support and connect program. And we're actually managing, not in terms of the really high needs people that you're working with, but we're actually helping people to link into the My Aged Care. We don't have an age limit, or if there is an age limit, we go from 50 plus. And we're doing a lot of work in terms of actually trying to advocate for them with other agencies. And as I said, we'll help them access the My Aged Care, but we're not providing intensive support on an ongoing basis for a long period of time, but we will help them transfer across and link in.
That would be great. I actually, I work very closely with short-term support team, from Knox City Council. So I think it's similar, for what, your program, in the future. So the short-term, support team, sometimes send referral to me. So they will screen, whether if, just simple referral, they can do it. But, if require, more intensive, advocacy, and then they will refer the case to me.
Yeah, that's what we see is happening, that them really working with the most vulnerable and the intensive people, but also actually being able to make the transition across as easy as we possibly can, because some people will still find it difficult to transition.
Exactly the same. The same. I received, several, complex case, from North City Council. So one is the hoarding case, and it's very difficult. Oh, I also, want to mention, like my program, I also have the hoarding and scholar, funding. So in case, any hoarding and scholar, case, you can refer to me.
Okay. Thank you.
Yeah, you're welcome.
Thank you, Amy. Does anyone else have any questions or comments?
Just wanted to say thank you, Amy, because I have worked very closely with you in the past, and I know how dedicated and passionate you are. So thank you. You really support the vulnerable clients that we work with. And you're very responsive to our emails too. So thank you.
I just received your email. You have difficulty, to get rid of the furniture. Is that correct?
Yeah, I'm seeking out a single bed and mattress, but we'll get there.
Yeah. My role also, support the client to access the Eastern Emergency Relief Network, the warehouse. So sometimes the homeless, client, they have nothing. All right. So, I have to, support them, to set up, the furniture, and get the furniture on everything. Yeah.
And do you have a referral form as such, Amy, to refer to you? If we wanted to refer to you?
Just send an email. I don't
just
have
an email?
The formal, just, send an email. In the past, Edge program, we have the referral form, but now, we don't have, we're just gonna have the housing and care connection assessment form. But I think, you're just gonna send me the referral and let me screen the eligibility, and that's fine.
Can we get a copy of your email address or something? Is that possible to be sent out, or a flyer or something like that if you have something?
Yes, I can. Maybe, I send the fact sheet. We have the fact sheet, and I send to Elizabeth, and you can send to your network.
That'd be great. Thank you. Yeah.
So you are always welcome, to contact me, in case, any case. Yeah. So even though, some case, not in my catchment area, but I can redirect you, to the right care finder program. So I just want to know now, this is my interest to know more about the dementia services update. Because, it changes, a lot. So for example, like dementia, any new programs, from dementia services, Korea, has closed. So where the client, go to activities or day program, or any, funding, can support, the client, who has dementia.
It's a big question, Amy. We will put this link up on the website of all the guest presenters that we've had at the Dementia Knowledge Network, which are sort of themed into topics each meeting each month. But essentially, that's why this group was founded. So Sarah and I were sort of talking and flagged that during COVID, all services seemed to either close or were really heavily restricting and limiting their support offerings. So we wanted to reconnect service providers and consumers and just have a little bit of, I guess some airtime around what's available, how can we refer on, advocate and collaborate with different providers. But there's only a handful that are still operating as they were, going back 5 years or so. Sarah's probably a better person than I am in terms of day respite options. Do you want to quickly give an overview?
So we're providing day respite and flexible respite for people with dementia out at Murrelbark. I'm from Caledina. Donwood in East Ringwood is still providing services. Kalara at Ringwood is providing, I think, 1 day of dementia specific. The Haven at Baronia has 3 days of dementia specific programs. Olivet, also in Ringwood, is providing programs. Olivet and Donwood are both looking to increase their services. All of our services have wait lists at the moment, and the demand is increasing. And the clientele are changing as well. So people with some really complex behaviours, as well as people much, much earlier looking for peer support and recreation opportunities rather than respite.
Yeah. Okay, that's good.
And there's Uniting Age Well in Noble Park is one, and Maranoa House, but that's more Glen Waverley kind of area. But the there was one, and I want to, Sarah, while I've got you, had a client that was talking about one in Baronia, WAACG or something.
We've only just heard about that, and it's connected to an aged care facility.
Yeah, and she was saying that her partner was able to go there. They have day respite as well, and at a cheaper cost from a home care package point of view, much cheaper. So it was kind of something that I hadn't heard of before. So yeah,
the Haven used to be in Baronia.
it's still there. It's still there. It's a different one.
Because I tell you what, I've been ringing all the councils that we work in to try and get a bit of an update on what services are being offered to people over the age of 65, and most councils, as you would know, Jen, they've a lot of the services have actually ceased. Very few have planned activity groups, and look, I think it's actually having negative impact on our client group. I don't think
there's many councils that do any anymore.
Only Monash.
I don't know. Yeah, Monash do. Yeah.
Monash is still quite active. They provide the personal care, the in-house respite, all of the traditional services, and I think they do run some groups. I think they run. Is it Halcyon? Does Halcyon come under them?
Yeah.
Yeah, that's right. You said Haven, and I was thinking of Halcyon. So but the rest of the councils, they don't have services. They've gone into this like the positive aging model, the bus outings, the swimming, but not all clients can participate in those. So it's a real problem, actually.
It's really, really difficult because as most of you will know, there's just no services available. They can get approved by My Aged Care for CHSP services. There's absolutely no providers. And of course, if people in the area have absorbed councils, previous clients, there's no room.
No.
For them to take on new people.
And Yarra Rangers is finishing up all their CHSP.
Yeah, there's more and more councils doing it. Yeah,
they've got Golden Wattle, but that's now run through each as well, so that's not even a council anymore either. So I don't know anything through them.
I think that's only 1 day.
Yeah, 1 day. Yeah.
So there's a desperate need for more.
Yeah.
But because of the funding model, the social support funding is going to kind of one-on-one models with the home care organisations. and being paid for through your package, you get a cup of tea out at the local shops for an hour with a care worker. And all that work we did, the benefits of social support and the benefits of groups and all that sort of stuff seems to have been ignored pretty much.
But it also has a massive impact, Sarah, on the carer. You know, like they're now,
Absolutely.
instead of getting a 5, 6, 7 hour break, they're getting a 2 hour break, which is, you know, crazy.
Yeah,
it's crazy.
Yeah.
We keep pushing on.
Yeah, I just want
Well,
to
the
know,
aged care
because
reform's going to fix it.
yeah, I need to, know more about the services. Sometimes, I may have, cases, who has dementia specific. So, who is, which organization or who is the starting point, I can approach, so that, I can get the updated information, or sometimes, I need to seek advice, how to support, the client.
You can always, like, Dementia Australia has a 24-hour helpline that you can call. That could be a good place to start. That's 1-800-100-500. But I mean, I spend a lot of time Googling this sort of stuff and I work for DA. So it's like, you just have to spend time looking at things. But yeah, any kind of stuff. I mean, I'm happy for you to get my email, my contact details, and give me a ring if I can help out. That's fine. But yeah.
And now, if it's a clinical service that you require, like if you've got someone that has dementia that's got behavioural problems, like if they're paranoid, if they're aggressive, if they need input from our service, you could refer them to us. We've changed our name now. It's the Older Adult Mental Health and Wellbeing Program.
Oh dear.
Yes.
So Steph, which organization you come from?
Eastern Health. You
Eastern
know me,
Health.
Amy.
Oh, okay.
You know me. We've worked together on clients in the past. Been here a long, long time. Yeah. So I'm with the APAT team.
Okay.
So you take clients that with dementia. I've often
absolutely.
had been told that if it's not a mental illness, then it's not kind of,
Who
covered
told you
in that.
that?
Oh, I've been told that many a times. So yeah,
Oh my goodness, Rachel.
Yeah,
I mean,
yeah.
I'd say probably at least a third
Yeah.
of our patients have either early cognitive impairment or, full-blown dementia with BPSD. And sometimes we actually are involved in the diagnosis process. Like I've had two clients recently that have got the BPSD, but no formal diagnosis. And the carers were kind of pulling their hair saying, what do we do? And so we come in, we see them, we, say, yep, definitely, this is dementia. And then I refer to my aged care, I refer to PAGs, I refer to everything that needs to be done. And then we commence them on some medication and monitor their mental state, provide psychoeducational support to the carers, and journey with them for a period of time. I mean, not years, but but at least a few months to kind of get them on the right medication and to provide set them up for the future in terms of what services are required, talking about even things like powers of attorney and stuff like that. So
that's great.
I'm surprised, Rachel. You've been told we don't see people with dementia.
Unless it's like a anyway, that's
well,
they've got to
have behavioural problems associated. We don't just see people with garden variety dementia that go to a geriatrician, but
exactly
more where there's the BPSD.
Yep. Okay, great.
Yeah.
And I would suggest, and this goes for anyone in the group or anyone you're talking to, if you do have questions about what's available, email either Elizabeth or myself, and we can put it out to the whole network and say, does anybody know of, or what's happening with this group, or does anyone have any suggestions? And pull on that knowledge of, I know there's only 15 people here, but there are about 80 people on the mailing list. So pulling all that information, all that knowledge could be really useful.
Sarah, can I be included, in your network, in your list?
Absolutely.
That's great.
Well, does anyone else have any final questions or comments for Amy? It's been a really good discussion today. Thank you so much, Amy. We really appreciate your presentation. That was very informative and I think raised a few more questions and opportunities for, points of referral and things in the homelessness area. So thank you.
Yeah,
Thank you
thanks,
very
Elizabeth.
much.
Right.
Yeah,
Appreciate it.
thanks, Sarah.
Thank you.
Thank you
Thanks,
for coming,
everyone.
everyone.
Thank you.
Bye-bye.
Thanks.
Thanks,
Thanks.
Bye-bye.
Bye.